Hello, Jerry. My name is Josh Deere. Um, it's nice to meet you. I have a lot of Asperger's syndrome, and I'm here on this group today to ask you a few questions.
Hi Josh, my name's Jerry Newman. It's very nice to meet you too, and I'll do my best to answer your questions.
Could you introduce yourself and tell me a little bit about your job?
Well, I'm Jerry. I'm a primary learning disabilities liaison nurse, and my job is to support the GPs and everybody really who works in GP practices, like the nurses and the receptionists and the administration workers, all those kind of people. I support them to help meet the health needs of people with learning disabilities and autism. And a part of that is to make sure that people have annual health checks. So we're doing a really big push to make sure as many people have annual health checks with their GPs as possible.
Question two is, how has your job changed since the coronavirus pandemic?
That's an interesting question. Well, my job changed massively overnight as soon as there was a shutdown. I had to start working from home. None of us were allowed to go back into the office. And that made a really big difference because I was then really missing my workmates, who I used to see all the time. So I was missing them. And it meant I had to stay at home and do my work on the computer and on the telephone, and only really visit people if it was an absolute emergency, because we were trying to do everything the government said about, protecting ourselves and other people. And the other thing that changed a lot, Josh, was that whereas before we were going into GP surgeries and helping them out a lot, and we were pushing the annual health checks, all that stopped because everybody concentrated then on coronavirus. And we did exactly the same things as liaison nurses. And we worked out that the people we were most worried about were the people who lived on their own and didn't get much support, either from family or support workers. And so we had a big project then to get on with, to contact these people, to write to them and to introduce ourselves and give them our contact details. So it was a completely different type of job we were doing.
Third question, what do you think the new normal looks like for your role going forward?
Well, we're still trying to work a lot of it out, but at the moment, what seems to be happening from a health perspective, things are beginning to get back to normal. And so I think annual health checks are going to start up again, so we'll be busy helping out with those. What it does mean is that everything I do when I go out and see patients or doctors, I have to wear a mask, and I have to wear a visor and gloves and an apron and all that sort of thing. So that's going to make things quite different for me. The other thing, though, that isn't going to change is that we've worked out as liaison nurses that we can have more meetings together, which is a really good thing, if we do it online. What we used to have to do was take it in turns, either me driving all the way from Felixstowe to Bury St Edmunds to meet with my colleagues, or they'd have to drive from Bury St Edmunds to Felixstowe to meet with me. And that used to take a really long time. I don't think we're going to do that anymore. I think we've decided meetings like this are a much better way of doing things. So I think we will carry on with having meetings like this.
Question 4. When the surgeries come back open, will anything affect the GPs?
Well, again, that's another really good question. Now, the surgeries are now open. They're definitely open. people can go and see doctors if they need to. What's changing at the moment is that there can be slightly different ways of contacting the doctor in the first instance. So instead of just phoning up for an appointment the way we used to do it, what's going to happen now is when we phone up the surgery, what will probably happen is a nurse or a doctor will then phone you back, will have a chat with you on the phone, and if they decide, you decide that the best thing to do is to come into the surgery, then that's what will happen. And what we found now is that when people do go to the surgeries and see their doctors, their appointments these days are lasting a little bit longer because people aren't having to queue up for appointments anymore. So that's quite a good thing. What you will notice, though, when you go to the doctor's surgery is that the doctors will be wearing masks, and they might be wearing visors, and they'll be wearing gloves and aprons. But this is a really good thing because it's going to keep them safe from catching the virus, but it's going to keep us safe as well. They're keeping the surgeries very clean. So I think it's safe for people to go to the surgery if they think they really need to and if they really need to be examined by a doctor. But one of the things I've noticed most of all is that when I do go to the surgeries, they're really quiet at the moment. There are not lots of people waiting in waiting rooms anymore. So I think that's a different thing now.
And the final question, will the rule of people wearing masks last all year or from now on, do you reckon?
I can't tell you what the government are going to say because I don't know if the government have decided if it's going to last all year. At the moment, the government's advice is that, or the government's instructions really, are that if people go on public transport, they have to wear masks.
Mm-hmm.
They're encouraging people and saying it'd be a really good idea to wear masks if you're going into buildings, into enclosed spaces.
Mm-hmm.
So I think that will continue. I'm certainly going to continue doing it because I think that's the safe and the right thing to do. So I'm going to carry on wearing my mask. I probably won't when I'm going for walks and exercises outside when I know I've got lots of space between me and other people. But I do think when I go shopping, I'll wear my mask. And if I go to the doctor's surgery, I'll wear my mask. And if I had to catch a bus, I'd wear my mask. And I think that will carry on for quite a few months yet. But I'm getting used to it now, Josh.
That's good. That's very good. Well, unfortunately, that has come to the end of all my questions. I have enjoyed this very much, and I thank you for answering all of them.
Well, thank you very much for having me, Josh. It's been a pleasure. And if there's anything else I can do in the future to help, please let me know.